All right, good morning, guys. I've got another little helper here. This is my youngest, Katie, and she's been at one of her grandparents' houses for a few days, so I'm glad to have her back, and she's gonna help me with this one. So we're on part 3 of talking about our outpatient care, what's changed, and part 3 is titled,
Who decides when you need to be seen?
Okay, in the last video, I talked about medication refills and why they aren't always as simple as they seem. Today, I want to talk about another part of outpatient care that most patients never see. Who decides when you need to be seen? And the answer is, it's not always as straightforward as people think. When a patient calls a doctor's office, they're usually focused on one thing. I don't feel well, my symptoms are getting worse, or I just need to be seen. What most patients don't see is the stuff that happens between that phone call and actually getting the appointment. Someone has to gather information. Someone has to determine what details are important. And someone has to recognize whether those symptoms can safely wait or whether they need to be escalated to a clinician right away. And every practice has its own workflow for how those decisions are handled. This isn't about criticizing those systems. It's about recognizing that healthcare isn't just scheduling. Sometimes it's triage. Sometimes it's recognizing those subtle warning signs. Sometimes it's hearing one sentence out of the many that completely changes the urgency of the situation. And as a nurse, I learned that patients don't always know which detail is the important one. They'll tell you 10 things, and buried somewhere in the middle is the one sentence that changes everything. And what that taught me was that the first message a patient gives you is rarely that whole picture. And it's not because patients aren't clear, but because symptoms don't always show themselves all at once. And that is where clinical judgment really becomes important.
Sometimes it's what they say. Sometimes it's what they don't say. Sometimes it's how they sound. Sometimes it's how their story has changed since the last conversation.
I remember times as a nurse where a patient would initially say they just weren't feeling well. But after a few more questions, something came up that completely changed how urgently they needed to be seen. And in outpatient surgery settings, it could also go the other direction. Sometimes one detail would reveal something that needed urgent attention, and other times, a symptom, a lab result, or even a missing piece of information could mean a procedure has to be delayed for safety reasons. Those things aren't always obvious, but they do matter. I've also been on the other side as a patient now, as you well know. And I've experienced how frustrating it can be when you feel like the urgency of what you're experiencing isn't fully understood. Not because anyone doesn't care, but because information can become fragmented as it moves through a busy system. I think one of the greatest strengths nurses have always brought to outpatient care is connecting those pieces.
Listening, clarifying, asking one more question, recognizing when something doesn't quite fit, because sometimes that extra question changes everything.
Most days, the right decision is made. But when systems become busier, when communication becomes more fragmented, or when clinical context becomes harder to see, that's when the risk of missing something begins to increase. So, when I ask who decides when you need to be seen, I'm really asking a different question. I'm talking about how clinical urgency is recognized or sometimes missed in real time. How do we make sure the right information reaches the right clinician at the right time? Because ultimately, that is what patients are counting on. In the next video, I want to talk about documentation. This doesn't just record care. In many cases, what determines access to care isn't just symptoms. It's what gets written down or documented. And even more so, how it gets written down, or if it even gets written down at all. And a lot of times that shapes the care that comes next. Never lose sight of the person behind the symptoms. Remember the human in healthcare. This is just a nurse writing from a patient's chair. Thank you, and we'll see you again tomorrow.